Hi, Dr. Pelto here. Today I want to talk about how you can spend $1,840 on plantar fasciitis and still not get better. I had a patient that came in recently. He'd spend over $2,000, so I just kind of randomly picked this amount on his plantar fasciitis before he came in. And he came in and he got one cortisone injection with some PT and he got better. But he spent all this money prior. And so I don't want anyone that's watching this to have to do the same thing. So you can see some of the categories, how you could spend some money, and we're going to look at why these might not work. Shoes, night splints, massaging, Aleve, compression sleeves, orthotics, foot stretchers, urgent care visits. So let's go into this. Some shoes that you may see touted for plantar fasciitis. Hokas are a good one. Echoes are good shoes. Some UFOs, inserts, flip-flops with nice arch supports. Those are all good. But why don't they cure plantar fasciitis? Well, if you try and spend over $500, or you try more than 2 or 3 pairs of shoes and your heel pain doesn't go away, the problem probably isn't the shoe. The problem probably is inflammation, and you have to get down that inflammation and not just get a new shoe. So if you try every single shoe, shoes that are advertised for plantar fasciitis are more likely for marketing purposes. What you're looking for is a nice stable shoe. I like some of the common brands: Asics, New Balance, Saucony, Brooks. There are some other ones that advertise that are very good as well. You can try those, like Hoka's and some of the other ones. Okay, next, night splints. Night splints are used when you get up in the morning. If you have pain, or when you're sitting down and you have pain, you can wear a night splint. It stretches the Achilles tendon and the fascia. Why this wouldn't resolve your pain? Well, if it's more severe than just a simple pain in the morning when you get up and there's pain throughout the day, it's probably not sufficient enough. There are other things that you should be doing, possibly physical therapy, possibly foam rolling and other things like that along the calf. Massaging, so massaging the foot, massaging the calf, all these can help. So if you get 3 massages at $100 a pop, that might help temporarily, just like foam rolling, just like the night splint. But if it's not resolving the pain, it's probably because there's inflammation and you might need something more. Next, taking Aleve. You can take Aleve for a period of time. That may help. Any other anti-inflammatories may help. But once again, when you stop taking it, if the inflammation is too much, may not work. Compression sleeve, they do tout a lot of these cute little compression sleeves. They give support, kind of like taping your foot, and it can help, but many times that by itself, once again, may not resolve it. Custom inserts, I've seen some of these advertised. They're kind of a neat idea. You put your foot in this little box and you step on it, and they say they give you a custom device. Well, it's not really custom, but it's better than some of the over-the-counter, maybe a little bit better. This is an over-the-counter brand that I think is pretty good. You could try this, usually $35, $40, maybe $50. I wouldn't spend more than $50 on an insert, but some people pay more, substantially more. This is one where you step in the foam box, send it in, they make you an orthotic. They call it an orthotic. I guess it's custom as long as you put your foot in the right way, but you have to put it in, technically speaking, what we call subtalar joint neutral and everything else like that. There are some newer ones that are coming out which are promising, where you scan the bottom of your foot with your webcam. And there are some other ones that I wouldn't do, but there are some brands they say it's custom, but it's really not custom. You may stand on a weight plate and they'll go out and get you what they call a custom orthotic. The only ones that are really custom are the ones that are made by a laboratory. There are some 3D printing that is starting that has some good potential for an insert. A foot stretcher, some people buy these things. They stretch it. You can spend up to $100, maybe a little bit less, but it stretches your fascia. Once again, I don't really like these at all, but it's a good way to spend some money. And then lastly would be an urgent care visit. So urgent care visit, they would get an x-ray, charge you a certain amount, and then you'd see the doctor, up to $450 for that. That visit just really isn't the best use of your time. I think it's better, if you're having foot pain, not to go to the urgent care, not go to the emergency room, but probably see a podiatrist. That's probably the easiest way. So let's look at what are the most effective treatments. This is important for you. So I call this the plantar fasciitis treatment evaluator. Okay. The things that we were looking at, the night splint is down here. Okay. The compression sleeve is down here. Supportive shoes, over-the-counter arch support is right here. Anti-inflammatories are all right here. So all these things are moderately effective, in my opinion, moderately. The most effective things are the things that only a doctor can do, probably a cortisone injection ordering some physical therapy for you and doing a custom orthotic. That's my general take, and that's why a lot of these other things that are moderately effective, like icing and stretching and all these other things, they're not going to really resolve it for some people. A lot of people do get better with those things, and I'm not trying to knock those, but some people that don't, it may be because you need some other things like a cortisone injection. So don't wait a lot of time. If you're trying to spend all your money, if you spend over $2,000 and you've been treating it on your own for 6 months, even if you don't have insurance, it's probably easier to go to a professional, a podiatrist, and pay for the office visit and see someone. I know there's a lot of copays and things like that that are a concern. So if you want more information on the bottom of this video, you can download the Plantar Fasciitis book. It's a book I put together for my patients, and if you're watching this, you can get this book. It's free. It has a lot of good information in there. Hope you enjoyed it. Thank you.